With COVID-19 lockdowns, heightened work and demands, personal stress, increase in street violence, overdoses, and suicides. Wow, just so much has been happening these past 10 months. It's cause for conversation about workplace violence. Today's presentation addresses it on an organizational level and is designed for C-suite executives, human resource managers, as well as supervisors and administrators. This information is not intended as legal or consulting advice. Today, we're going to talk about just a few of the violent events which are routinely experienced by our frontline healthcare workforce. Workplace violence is a difficult topic, and it's not merely the heinous violent events that make the news, but what is overlooked on a day-to-day basis, even within our own organizations. Workplace violence results in low staff morale, lawsuits, and high worker turnover. We can't afford that economically, and we don't want that for our workforce. High turnover is associated with job burnout, defined as a negative reaction to constant occupational stressors. There are 4 workplace types of violence, and this is from a study from the New England Journal of Medicine. The first type is by perpetrators who have no association with the workplace or employee. The second type, the assailant is a customer or a patient of the workplace or employee. A third type is when the attacker is a current or former employee of the workplace. And the fourth occurs when the perpetrator has a personal relationship with the employee, but not with the workplace or the organization. One unrepaired broken window is a signal that no one cares. And so breaking more windows, oh, that costs nothing. Let's just keep doing it. We can't have that kind of attitude. We have to look at every event as a broken window that needs to be recognized, repaired, investigated, and resolved. Recognizing verbal assault as a form of workplace violence cannot be overlooked, since verbal assault is a risk factor for battery. The Joint Commission has published a number of what we call Sentinel event alerts. They're designated to help healthcare organizations recognize workplace violence and better prepare their staff to handle violent incidents. The first paragraph of Sentinel event number 59 starts with a quote on this slide, which I'd like to read to you from registered nurse Lisa Tenney. Been bitten, kicked, punched, pushed, pinched, shoved, scratched, and spat upon. I have been bullied and called very ugly names. I've had my life and the life of my unborn child and of my other family members threatened, requiring security escort to my car. I think we all have to agree that this is something that can't be tolerated. It is important to note that employers are required to provide a place of employment that is free from recognized hazards that are causing or likely to cause death or serious harm. This is under the General Duty Clause, Section 5A1 under OSHA. Now, while employers deal with an increase in drug abuse and COVID-19 cases of our own workforce, it is important to have discussion about what workplace violence is and what it isn't. Let's look at various definitions to gain a better understanding of what workplace violence is. The Centers for Disease Control, or the CDC, defines workplace violence as an action intended to control or cause, or is capable of causing, death or seriously bodily injury to oneself or others, or damage to property. Workplace violence includes abusive behavior towards authority, intimidating or harassing behavior, and threats, and can be in the form of verbal, written, or physical aggression. The World Health Organization defines workplace violence as incidents where staff are abused, threatened, or assaulted in circumstances related to their work, including commuting to and from work, involving an explicit or implicit challenge to their safety, well-being, or health. The World Health Organization considers both physical and psychological harm, including attacks, verbal abuse, bullying, and both sexual and racial harassment, to be workplace violence. So, how common is this problem? Likely a lot more common within our organizations than we want to believe. Taking the healthcare industry issues of workplace violence as extremely important is needed during this pandemic fatigue because the aftermath includes both physical injury and psychological components related to how secure healthcare workers feel when they return to work. This, coupled with COVID fatigue, quickly becomes a human resource crisis which needs to be managed. The American Journal of Managed Care, or AJMC, article states that while 75% of nearly 2,500 workplace assaults occur annually in healthcare settings, only 30% of nurses and 26% of emergency department physicians have reported incidents of violence. It is critically important for C-suite executives, managers, human resources directors to assure that suffering in silence is wrong and only permits the problem to continue without giving administration the opportunity to mitigate these types of situations. We don't want our workforce to feel that they need to just deal with it. Those unfamiliar with daily events in healthcare situations and institutions may be shocked to learn that violent altercations are so common that most employees in the field consider them to be simply part of the job. In the decade between 2002 and 2013, the United States Department of Labor and the Occupational Safety and Health Administration, or OSHA, found that occurrences of serious workplace violence, which required time off work for the injured worker to recover, were 4 times more common in healthcare than in private industries. Among healthcare workers, psychiatric aides experienced the highest rate of violent workplace injury, with 590 reported injuries per every 10,000 full-time employees. Nursing assistants made up the next highest at-risk group, with 55 injuries among every 10,000 full-time employees. For comparison, all the reported incidents in the private industry combined equaled only 4.2 injuries per 10,000 for full-time employees. 80% of serious violent incidents reported were caused by patients. 21% of RNs and nursing students reported being physically assaulted, while 12% of emergency department nurses experienced physical violence, and 13% of Veterans Health Administration hospital employees suffered assault. Verbal abuse statistics are also very concerning.
Thank you for joining us for part 1 of a 2-part series. Workplace violence is an issue, especially for healthcare organizations. We advise and ask that you watch part 2, where we offer guidance from authoritative organizations such as OSHA and the Joint Commission with suggestions and solutions.